Hi, I'm Linda from Center West, and I'm for a non-smoking policy because I have smokers next door, and I'm just coming off pneumonia. I work 5 jobs, and I really need to be healthy, and the smoke just seeped into my apartment, and I was so sick, and I went to the doctor, and they gave me antibiotics, which were starting to take effect until the smokers next door exacerbated it, and it took way longer than it should have for the antibiotics to kick in. And so I really think that we need to have a healthy environment.
I live at the Olympic West Apartments, and I am a heavy smoker. I have caused extensive damage to my apartment, nicotine damage. I've also caused myself some health problems by smoking. I am currently trying to quit and completely in favor of the non-smoking program because I feel that it will give me the additional incentive that I need to hopefully accomplish that.
I'm Glenda Button from 110 West Olympic Place, apartment 605. I've been here 25 years and experienced 2 fires, one on the floor below me. They were both at night when we were in bed. And I'm against smoking in the building because that infringes on my rights. And I hope I never have to experience a fire again.
I'm Joe Ellis. I live at Olympic West, and I knew the policy was coming. I knew it was coming, no smoking. I knew that, and I'm just not really sure about the way, how I feel about it. I know we don't need to smoke, and no one needs to smoke. No one needs secondhand smoke, but I think there's going to be so many complications, and I'm looking at the long term, like people getting put out of their homes because they're smoking. That's what I'm thinking about. And that's just really scary to me. So, I don't know. Thank you guys for being here and opening up the dialect. I think that's great. I'm just not sure how I feel about it.
Hi, my name is Gene Ferguson. I live at Ballard House over here in Ballard. I love being here. I love the fact that the Seattle Housing is considering a no smoking policy. As a former smoker, I have since quit, and I have been offended by my neighbors smoking outside, coming in my window, which I think is kind of funny considering I was a smoker at one time and was oblivious to that fact. However, as one, I have sympathy for the smokers that are currently still addicted. And I would like to see Seattle Housing consider a place for the people to sit and gather and smoke away from the buildings. Each one could be, regulated according to the property. But I do think that would be a little bit of a consideration for Seattle Housing to take. And
It's Ronald Corbin. I live at Tri-Court, and it's a non-smoking building. I like it non-smoking. Where I came from, it was a smoking building, and I used to smoke. I smoked for 50 years or longer, and I have lung cancer now. They took out half of my left lung. I have emphysema so bad I can hardly breathe sometimes. So smoking is just no good, and if it took me at least 10 times to quit, but if I can quit, anybody can quit. And that's all I can say.
Hi, my name is Mike. I live at University West, and I'm for the non-smoking building because I have a heart problem and breathing problem. And I think most of the people in this building are for the non-smoking part of it.
Hi, my name is Roseanne Kimlinger. I live in Lichtenwood. And I am very much in favor of a no-smoking policy, as I am a non-smoker. I get cigarette smoke smells in my apartment at least once a day, and I don't like it. Also, one of my concerns would be how the 25-foot no smoking outside the building rule would be enforced, as my apartment is really close to the deck in Lichtenwood. And even now, In the summer, when people are outside smoking, I get smells from the deck into my apartment. And my concern is that after people are no longer allowed to smoke in their apartment, more people would be out on the deck smoking, and I'd be getting that much more smell in my apartment. Ideally for me, there would be no smoking allowed on the deck here at Lichtenwood. And, you know, again, this would be a wonderful policy for me and my lungs. Yeah.
My name is Robert Wright. I live at Tricourt. I've lived here since 1987, and I have never been a smoker, and it's been nice to be able to go into the hallways and take a nice fresh breath of air, and that hasn't been the case in other facilities. And I would like to encourage this non-smoking policy to be extended to all of the buildings that SHA manages. It should benefit everyone's health and enjoyment of their facility.
There, I'm Diana in 209, and I would definitely like a no smoking policy in here because we have smokers whose smoke gets out in the hall and into other people's apartments. You can smell it just walking down the hall sometimes. Some of these folks don't have money for really good cigarettes, so they smoke butts or what they find on the streets, and it definitely affects other people because you can smell cigarettes that have been used more than once, for example, and it does get into other people's apartments. And also we have people who are sick living side by side with smokers, and I know for a fact that it does affect them. A woman that used to live across from me had a lung transplant, and there were smokers on two sides of her, and it was definitely making her sicker. That's not to say that's why she eventually passed away. She had other problems, but it was definitely not good for her or really anybody else. So anyway, that's what I wanted to say. Thank you.